Good afternoon. Our first item today is portfolio questions, and we're starting with education and skills. I would remind members that questions 6 and 8 have been grouped. Question 1 is not lodged. Question 2, Emma Harper.
Thank you. To ask the Scottish Government how it is supporting the teaching of STEM subjects in Dumfries and Galloway.
Minister Richard Lockhead.
The Scottish Government's STEM education and training strategy sets out a range of actions to support practitioners teaching STEM subjects in our primary and secondary schools, in early learning and community learning and development as well as, of course, our colleges and universities. In Dumfries and Galloway specifically, support for professional learning is provided by a designated Education Scotland STEM Education Officer that's now been appointed, and practitioners will also benefit from resources with a focus on cluster working to support professional learning in STEM, numeracy and mathematics and science through work supported by the Enhancing Professional Learning in STEM grants. So all of this will build on the great work started as part of the RAISE programme, and this is being further enhanced through the creation of a digital and physical hub and spoke network to facilitate digital learning in rural locations as well.
Emma Harper.
Thank the Minister for that reply. Dumfries and Galloway College are working towards plans to build STEM extensions at both the Stranraer and Dumfries campuses to allow for research and courses on maintenance and construction of renewable technologies. Would the Minister join me in welcoming this work, supported by the South Scotland Economic Partnership, and would he commit to perhaps visiting D&G College to meet the students and staff in the near future?
Minister.
Well, of course, I can say to Emma Harper, I warmly welcome the development that she's referred to, which, of course, again, as she's referred to, is being supported by the Scottish Government as part of a £6.6 million investment in the South of Scotland Economic Partnership Skills and Learning Network. So through the creation of that hub, the project seeks to address the immediate skills gap that have been identified in the region in key sectors, and I'd be absolutely delighted to visit Dumfries and Galloway with Emma Harper to review for myself the good work to support STEM that's taking place there.
Thank you. Question 3, James Kelly.
Thank you, Presiding Officer. To ask the Scottish Government how it supports students in higher education.
Minister Richard Lockhead.
The Scottish Government's commitment to free tuition ensures that full-time Scottish domiciled students studying for their first undergraduate degree at publicly funded higher education institutions in our country do not have to pay fees. And this means that they do not incur additional debt of up to £27,000. We also provide a minimum income guarantee of £7,750 per year for students from the most disadvantaged backgrounds through a combination of bursaries and loans. And from 2018-19, we also increased the Care Experience bursary to £8,100 per year. Further to this, following recommendations made by the Student Support Review, we will, during the 2019-20 academic year, provide comprehensive online information on further education student finance, and amongst other things. And we have also increased the student loan repayment threshold to £25,000 per year from 2021, ensuring that students are supported not only during their studies, but after they graduate too. And we're working on a range of other measures as well to give you a flavour.
James Kelly.
Thank the Minister for that answer. On the 20th of March, Parliament voted to implement the independent review of student support and, crucially, a minimum student income. Students across Scotland have had enough of delay on this matter, so can I ask the Minister when we can expect the plans for the implementation to be brought forward, and when will every student in Scotland benefit from a minimum guarantee?
Minister.
I thank James Kelly for the question. Of course, I remember the debate well, and as he will recall, the Scottish Government supported the principle of a minimum income guarantee for students. And as I indicated in my previous answer, we've already started to implement many of the recommendations of the independent student review that took place, including the £8,100 Care Experience bursary as well. Of course, given the overall cost of implementing all the measures in the student review, it would take some time and some expense to do that, but we will work our way through as we can and as budgets become available and as we calculate the cost of each individual measure. I have to say, though, that in comparison to the packages of support available in the rest of the UK, Scotland does give a very good package of support to our students in this country, not just in terms of free education, but also in terms of bursary for independent students who have independent means and don't have family support, also students from poorer family backgrounds as well. So we have a range of measures where we compare very favourably with what's been delivered elsewhere in the UK.
Question number 4, Brian Whittle.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to ensure that schools and teachers understand and accommodate the needs of young carers.
Cabinet Secretary John Smith.
Presiding Officer, all children and young people deserve the same opportunity to succeed and reach their full potential, and the Scottish Government is committed to ensuring that all pupils, including young carers, receive the support that they need when they need it. Under the Additional Support for Learning Act, education authorities have duties to identify, provide for and review the additional support needs of all their pupils, including young carers, and all schools have plans in place to do this. In some areas, schools have commissioned to prepare young carer statements, an approach which the Scottish Government supports. These are personalised plans covering a range of information about a young person's caring role, including their own individual needs and personal outcomes.
Brian Whittle.
I thank the Cabinet Secretary for that answer. I think when speaking to young carers and those advocating for young carers, a common theme is how patchy that support structure is for them across the education system. Some have excellent school experiences, others not so much, and this depends on individual teachers and their experiences in dealing with young carers. So given that every teacher is likely to work with young carers multiple times in their career, does the Cabinet Secretary agree with me that education of our educators should include specific instruction around the issue young carers may experience?
Cabinet Secretary.
I think Mr Whittle makes a fair point. It's important that all of our educators are equipped to deal with young people as they present themselves and the circumstances with which they are wrestling. And I think he's also correct that there are examples of outstanding practice within our country, and some which will not be as strong as that. I spent some time during the summer at the Young Carers Festival near Dunfermline, and I spoke to a group of young people who, even in that small grouping within the same local authority area, were able to recount a position which Mr Whittle has recounted today, where some young people had very specific and focused support in place and others less so. So I do agree with him that as part of continuous professional development of our teaching profession, as part of the understanding of the health and well-being aspects of our curriculum, that teachers should be equipped with that knowledge to provide the support that young carers require within our society.
Mary Fee.
Thank you, Presiding Officer. I recently spoke with the Renfrewshire's Carer Centre, who told me about young carers who feel isolated in school, struggle with bullying, and teachers who don't understand that they cannot complete their homework or arrive on time due to their caring responsibilities. And to change this, they are facilitating peer support groups in school and conducting awareness-raising training for teachers. What can the Scottish Government do to help support organisations like the Renfrewshire Carer Centre to provide these vital services? Cabinet Secretary.
Well, I welcome the information that Mary Fee has shared with us, and I think it illustrates the practical and tangible support that can be put in place for young carers. I think also the circumstances that she recounted of there being perhaps difficulties and challenges in the interaction of young people with school, whether it's about homework not being presented or not being able to get there on time, is part of how schools should be focusing on the experiences of individual young people. And if we are to sign up to an agenda of getting it right for every child, we should be engaging and understanding the needs of every single child. That's the founding ethos of our education system and the founding ethos of Curriculum for Excellence. Now, these are obviously significant policy approaches that the government supports, and I'm grateful to Mary Fee for putting on the record the specific ways in which that support has been offered within Renfrewshire, and I am happy to support that today.
Question number 5, Alexander Stewart.
Thank you, Presiding Officer. To ask the Scottish Government for its response to the satisfaction levels of local schools in Scotland's People's Annual Report.
Cabinet Secretary.
Presiding Officer, satisfaction levels amongst those who use our local schools was recorded at 86% in the Scotland's People Annual Report 2018. This is testament to the excellent work undertaken by all staff in our schools, along with the active participation of pupils and parents. I take this opportunity to commend them on their efforts.
Alexander Stewart.
I thank the Cabinet Secretary for that answer. The Scotland's People's Annual Report shows that after 12 years, the SNP government's satisfaction levels with services is at its lowest since 2007. 85% of people were happy with schools back in 2011. Now it sits at 71%. Does the Cabinet Secretary disagree with these individuals, or is he going to listen, take action and sort out the school issues?
Cabinet Secretary.
I think it's really important that we look at what the survey tells us about those who are actually using our local schools. And those who are using our local schools, parents or carers of school-aged children, are satisfied to 86% of the quality of school education and the quality of local schools. Now, obviously, we must continue to strive for continuous improvement within our education system. That is the whole focus of government education policy, a relentless focus on improving our education system and our schools. I think the opinion of service users is the one we should listen to carefully, because those are the ones that have got real, live experience of using our schools, and I think it demonstrates very significant levels of support and satisfaction with the quality of local schools.
Ian Gray.
So one of the things which parents and carers and others are concerned about in our schools is the narrowing of the curriculum in the senior phase in secondary school. On that basis, the agreement to undertake a review of the senior phase, which the Cabinet Secretary made earlier this week, is very welcome. Will he take this opportunity to tell us more about who will undertake this review and the timescale?
Cabinet Secretary.
As Mr Gray recounts, I agreed to the recommendation from the Education Committee that we undertake that review of the senior phase. We will do so. Independently of government. I haven't yet come to any conclusions about the names of individuals that will be involved. I am mindful of the fact that the review of the broad general education involved input from the OECD, which I think, for consistency's sake, may be advantageous to rely on some of their input. So I'll be giving consideration to these issues very swiftly, and I will update Parliament on the details of appointments and the timescale within which I expect this review to be undertaken.
Questions 6 and 8 have been grouped. Question 6, Adam Tompkins.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to reports that 1 in 10 pupils are taught in substandard schools.
Cabinet Secretary.
Presiding Officer, the number of poor or bad schools has decreased from 993 in 2007 to 288 in 2019. It is the statutory duty of local authorities to maintain the school estate across Scotland. However, the £1.8 billion Schools for the Future programme and the £1 billion Learning Estate Investment programme are means by which the Government is demonstrating our commitment to improve Scotland's school estate.
Adam Tompkins.
I thank the Deputy First Minister for that answer. Presiding Officer, the Scottish Government's own guidance advises caution when comparing 2019 figures with previous years because the measurements have changed. Last week, the SNP compared 2019 to previous years, and the Deputy First Minister just did the same again today. The Deputy First Minister is a serious politician, or at least he used to be, and he's got a choice here. He can either spin stats, or he can acknowledge that the SNP are failing thousands of pupils across Scotland. So can the Cabinet Secretary advise us all? Is he interested in accuracy, or only in papering over the cracks? In this case, literally.
Cabinet Secretary.
Presiding Officer, I'm of course interested in the facts. I'm also interested in improving the physical condition of Scotland's schools and the quality of education. It is what I am focused on every day of the week. Now, Mr Tompkins gives me the opportunity to place on the record some of the further detail in relation to the school estate survey, which I think is very important. The particular reference Mr Tompkins makes in the statistical bulletin is in relation to the effects on individual schools that may have changed their classification as a consequence of the change to the guidance that was applied in 2017. I'm advised by statisticians that that affects a small number of schools, which is why the statistical publication, which is not a publication from me, but a publication from the Chief Statistician, so it's not data that I have controlled, it's data controlled by the Chief Statistician, is presented and demonstrates year-on-year comparisons since 2007. And of course, Since 2007, we have seen the number of pupils who are educated in poor conditions or unsatisfactory conditions, poor or bad conditions, decline from 36.6% to 10.3% of pupils. Now, I accept that 1 in 10 pupils being educated in poor or bad conditions is unacceptable, but it is a colossal improvement on the situation, which is visible to any decent, naked eye around the country by the improvement in the school estate as a consequence of the investment by this government and by our local authority partners.
Question 8, Willie Coffey.
Thank you. To ask the Scottish Government how many schools have been built and refurbished and at what cost in East Ayrshire and across Scotland since 2007.
Cabinet Secretary.
President Officer, there were 928 schools built or refurbished between 2007-2008 and 2018-19 in Scotland, 21 of which were in East Ayrshire. Since 2007, the Scottish Government and local authorities have collectively invested around £4 billion improving Scotland's school estate. And through the Schools for the Future programme, Scottish Government and East Ayrshire Council have invested £143 million in 6 school projects.
Willie Coffey.
Can I thank the Cabinet Secretary for that answer, and what a great story that is to hear that this SNP government has completed all this important work in our school estate across Scotland. Can the Cabinet Secretary outline when all the schools in East Ayrshire Council will be upgraded and brought up to a satisfactory condition?
Cabinet Secretary.
Presiding Officer, in relation to East Ayrshire, according to the latest school estate statistics, East Ayrshire Council has 2 schools in condition C, which are poor condition. These schools are Netherthurd and St Sophia's primary schools. Improvement works are expected to be complete at Netherthurd Primary by the end of March 2021 and at St Sophia's Primary by the end of June 2021, which will mean that all of the schools in Ayrshire, in East Ayrshire, will be in the categories good or satisfactory. Now, Mr Coffey mentioned the scale of the achievement that has been undertaken in the building of all of these schools. That has happened during a period of austerity. And if capital budgets had remained at the same level as they had been in 2010-11 when the Conservative government came to office, we would have had in Scotland an additional £7.7 billion in real terms at 18-19 prices to spend on capital investment, which could have been spent on school investment had it not been for the cuts of the Conservative government.
Question number 7, Michelle Ballantyne.
To ask the Scottish Government what action it is taking to ensure that funded childcare places are flexible enough to meet parents' needs.
Minister Marie Todd.
Thank you, Presiding Officer. Quality is at the heart of this expansion because high-quality early learning and childcare has the potential to transform children's lives. As well as ensuring a high-quality experience for our children, we are also working to enable flexibility for families. To support this, and in preparation for August 2020, local authorities are working with providers to develop their plans for delivering the expanded hours. In line with their statutory duty to consult parents and carers on the provision of early learning and childcare, as set out in the Children and Young People Scotland Act 2014, local authorities are also working with families to inform how they make ELC available in their area in order to put in place a flexible and high-quality local offer. Michelle Ballantyne.
I thank the Minister for that answer. The requirement that all settings that wish to provide funded places have to offer the full 1140 hours requirement has meant that small settings who have to date been contracted to deliver 600 hours but can't or don't wish to deliver the full 1140 are being removed as a choice for parents. Will the Scottish Government consider revising this requirement to allow parental choice to choose blended care or fewer hours in small, high-quality settings?
Minister.
Certainly, it's a very good question from Michelle Ballantyne. What I would say is that blended provision is a cornerstone of many local authorities' provision. So they're already doing that. And as part of the phasing, they are consulting their communities to see exactly what's required. I refer back to my earlier question, my earlier response, in that the statutory duty placed on the local authorities to consult closely with local families means that they are aware of what's required in their local area, and blended provision is part of the provision in those areas where parents are requesting it.
Fulton McGregor.
Thank you, Presiding Officer. I wonder if the Minister can provide an update on the Scottish Government's recent work on the issue of deferment for children with mid-August to December birthdays, as highlighted by the members' debate on the 1st of May this year and by the Give Them Time campaign.
Minister.
Thank you. I want to put on record my thanks to Fulton McGregor for his work on this issue. I know that many of the founder members of the Give Them Time campaign group are his constituents, and that he's worked very well alongside them to raise their issues. I updated the Education and Skills Committee this morning on the work being undertaken by the Scottish Government and partners in relation to funded early learning and childcare and deferral of school start. We're in the process of updating the early learning and childcare statutory guidance to reflect legislative changes since 2014. And as part of these updates, we've committed to strengthen the guidance and providing an additional year of funded ELC and a deferred year. We'll hold a public consultation on the refreshed statutory guidance prior to publication. We've worked with COSLA members and with Give Them Time campaign on parental communication issues, and I want to put on record my thanks to the Give Them Time campaign for their support in this work. And I've updated Scottish Government web pages to provide more clarity for parents on their right to defer children's entry into Primary 1. We've also investigated the data available on deferral and uptake of early learning and childcare, and we'll publish new analysis using information from the pupil census.
Thank you. That concludes education questions, and we now move on to health and sport questions. Could I remind members that questions 2 and 8 have been grouped? And we start with question number 1 from Kenneth Gibson.
Thank you, Presiding Officer. To ask the Scottish Government when a women's health group will be convened and whether it will prioritise the treatment of preeclampsia.
Cabinet Secretary Jean Freeman.
Work on developing the Women's Health Group will commence shortly. It will consider a range of issues with a clear focus on tackling health inequalities for women, and I have already committed that the group will prioritise the testing for and treatment of preeclampsia in its work plan, which, as the member knows and has worked hard to raise awareness of, preeclampsia is a pregnancy-specific condition affecting 1 in 10 pregnancies in the UK, that's 80,000 women a year, and can affect both the mother and the unborn child.
Kenneth Gibson.
I thank the Cabinet Secretary for that positive answer. She'll be aware that preeclampsia is the cause of many stillbirths each year, and placental growth factor-based tests provide a reliable indication of whether a baby is at risk. My own son died a decade ago because 2 midwives and a consultant, among other professionals, did not diagnose preeclampsia in my wife, and so I know what many families have gone through. Can the Cabinet Secretary indicate when such tests will be available in routine clinical practice?
Cabinet Secretary.
I'm grateful to Mr Gibson for that supplementary question. As he knows, I have had recent discussion on this matter with my colleague Mr Fitzpatrick. We are waiting for some additional clinical evidence, but with the Chief Medical Officer, who is herself, of course, a consultant obstetrician, we will continue to actively consider how and when we can introduce additional measures for the diagnosis and then subsequent treatment of preeclampsia, and I will make sure that the member is informed on that as soon as I have that information.
And Monica Lennon.
Thank you, Presiding Officer. Scottish Labour campaigns forward a women's health strategy, so we welcome these developments. Can I ask the Cabinet Secretary again, because I think I asked last week, what funding is being made available to support this work?
Cabinet Secretary.
So there is a range of funding already in place for a number of condition-specific issues in clinical terms that affect women and only women, but we're also interested in the wider health issues where women's diagnosis and treatment research, as Ms Lennon knows, for example, in terms of heart disease, where women are treated differently with no apparent clinical justification for that. That is actually about changing treatment patterns and patient pathways in terms of those who diagnose and treat, and doesn't itself specifically require necessarily significant sums of additional funds. So as we look at the work of the group and it develops a women's health plan, then we will allocate to the different strands of that work and how it prioritises them, what we consider to be the relevant funding. And again, I will absolutely make sure that members across this chamber are updated when the group is established, who its membership is, how it is taking forward the work plan and its priorities, and what the time frame for all of that work might be, along with what additional resourcing is going in its direction.
Questions 2 and 8 have been grouped, therefore supplementaries will come after the second question. Number 2, Fulton McGregor.
Thank you, Presiding Officer. To ask the Scottish Government what progress NHS Lanarkshire has made with plans for a new build Monklands Hospital following the recommendations made by the independent review.
Cabinet Secretary.
NHS Lanarkshire accepted the recommendations of the independent review into Monklands replacement refurbishment project and also accepted the additional requirements that I made of them. This includes working closely with the local planning authority to ensure that they can support and contribute to a more constructive, inclusive and open site option review with meaningful public engagement. The NHS Board has established an oversight board, as it was required to, chaired by Dr Leslie Thompson QC, with the involvement of Sir Harry Burns. Members from the North and South Public Patient Forum will provide assurance on the progression of the Monklands replacement project, and this oversight board will report directly to the Board of NHS Lanarkshire. The newly constituted Oversight Board will have its first session on the 24th of September, with a meeting later in October, and timescales on its work will be clarified following that first meeting.
Fulton McGregor.
Thanks again, Presiding Officer. The Cabinet Secretary will, like me, welcome NHS Lanarkshire's commitment to work with others to redevelop the current site, and I quote from a recent letter they sent to me: to provide facilities to improve the health and well-being of local people, reducing their health inequalities and providing the opportunity for economic regeneration in the area. She may also be aware that households in my constituency have received a letter from Labour politicians using the language that the Monklands Hospital is to close. So for the avoidance of any doubt, can the Cabinet Secretary confirm the Government's support for a new Monklands Hospital, complete with an accident and emergency department that Labour were so determined to close in the past?
Cabinet Secretary.
I'm grateful to the member for that supplementary, and indeed that information is disappointing because, as members across this chamber know, and again for the record, both the First Minister and I have said on a number of occasions that there is an absolute commitment on the part of this government to see a replacement for Monklands Hospital built, a replacement which will include an accident and emergency service. The recommendations from the independent review, I've made it clear to NHS Lanarkshire that they need to look again at potential site options. I'm pleased they're taking forward that piece of work and engaging meaningfully with local planners and plans to engage with local residents. But let me repeat again, for the avoidance of doubt, there is an absolute commitment on the part of this government to see a replacement for Monklands Hospital built that will include accident and emergency.
Question 8, Elaine Smith.
Thank you, Presiding Officer. To ask the Scottish Government how many appointments have been made to the Monklands Replacement Oversight Board and what skills, expertise and local knowledge are reflected in these appointments.
Cabinet Secretary.
The new Monklands Replacement Oversight Board reflects a blend of patient and public experience from Lanarkshire, senior representation from the non-executives on the NHS board, including the employee director, supplemented by the expertise of Sir Harry Burns, a recognised international authority on health inequalities, and Dr Mike Higgins, a former member of the independent review team. The Oversight Board will also have access to the advice of a stakeholder engagement group made up of a wider mix of third sector, voluntary and patient group representatives.
Elaine Smith.
Thank you, Presiding Officer, and I thank the Minister. It's slightly more information than I've been able to get out of the Health Board up until this moment. The new board appears to be made up of the one new external member, 4 members of NHS Lanarkshire's board, and from what I can understand, possibly 4 others from local partnerships. So is the Cabinet Secretary confident that these new appointments will be independent? which is vital if she expects this to help restore public trust in an already flawed process, will she ensure that they are from the Monklands area and not the other side of Lanarkshire? And given the government's recent record on new build hospitals, with Scottish Labour pushing her to hold a public inquiry, will she now reconsider her decision and rebuild our hospital where it is in the heart of our Monklands community?
Cabinet Secretary.
I'm grateful to the member for that supplementary. I don't think anyone who knows Dr Leslie Thompson QC would consider her other than independent. The non-executive members of the board who are on the oversight board are precisely that, non-executive members, and as the member will know, they are appointed by me to boards and are therefore accountable to me. I think Sir Harry Burns is eminently independent, as are the other members, and of course the North and South Patient Public Forum are independent members too. I will take a very clear oversight in terms of being sure that the recommendations of the review are being implemented. That includes extensive, genuine public engagement, and there are a number of ways in which that can happen. And I understand that NHS Lanarkshire are considering discussions with the Alliance, who, as members know, have a very strong record in being able to work with local communities, eliciting their views and their opinions without having in advance of any formal consultation process. Let me repeat, though, in terms of the current circumstances in Lothian Sick Kids and with the Queen Elizabeth University Hospital campus, of course, ensuring that we learn the lessons from there and from previous matters in terms of the build will be informed not only by the public inquiry that I've announced, and I'm sure we will debate later, but also by the independent review into Queen Elizabeth, and indeed will inform the work of the national body, which I believe members supported last time. Finally, Presiding Officer, with respect to the current site where Monklands Hospital is, I think I made it clear when we touched on this before that in order to build on that current site, one would need to demolish the current hospital. There is no provision for the patients and services in that current hospital to be taken up in other hospitals, so we would significantly lose in terms of patient care, which I'm sure the member will agree with me is not something we would wish to do. We cannot build alongside an existing hospital, apart from the fact that there isn't the footprint to do that. In terms of patient safety and infection prevention and control, that would be a very foolish thing to do indeed.
Thank you. There's a very detailed answer, Health Secretary. I appreciate it a little bit more succinct. There's another question on this issue from Margaret Mitchell.
Presiding Officer, while I'm supportive of a new build Monklands, can the Cabinet Secretary give an assurance that the parking and flooding problems at the Gartcosh Crime Campus will be taken into account when assessing the suitability of the Gartcosh site?
Cabinet Secretary.
So those questions about parking, about flooding, about the nature of the land on which any new site, a new hospital might be built, will be taken account of on all the options that the Health Board is looking at, and will inform the option appraisal work that they undertake.
Thank you. Question 3 has been withdrawn. Question 4, Murdo Fraser.
Thank you. To ask the Scottish Government what discussions it has had with NHS Tayside regarding the delivery of primary care services across the area.
Cabinet Secretary.
Senior officials and the Chief Executive of NHS Scotland are in regular contact with NHS Tayside on a range of primary care issues, and I will be meeting the Chief Exec of NHS Tayside and the Chief Officer of the Health and Social Care Partnership for the area concerned on the 25th of September to discuss the future delivery of primary care services in the area.
Murdo Fraser.
Can I thank the Cabinet Secretary for that response? I know she has recently met my colleague Liz Smith to talk about the sudden closure of the Bridge of Erin General Practice Surgery, which has caused so much anxiety to local people. And she'll know that one of the concerns in the local community is a lack of a clear future plan for the delivery of primary care in the area. So can she give us an undertaking today this will be a priority issue for her to raise when she meets NHS Tayside, and when will she be able to report back to Parliament on the outcome of that meeting?
Cabinet Secretary.
I'm grateful to Mr Fraser for his question. I did meet his colleague Ms Smith. I think we had a productive discussion where I accepted her concerns over communication and engagement with the local community, lack of clarity over a long-standing commitment to invest £1 million of capital in Bridge of Erne practice, and a lack of a plan from the board, apparent plan from the board or the Health and Social Care Partnership on how services would be developed and delivered in the future. That is part of the discussion that my officials are having with respective officials in NHS Tayside, and that I will continue when I meet the Chief Executive next week. Following that, as soon as I am clear about the future plan, I think it's very important that there is one, then I will make sure that not only Mr Fraser but also Ms Smith and other interested colleagues are advised of that.
Mark Ruskell to be followed by David Stewart. Mark Ruskell.
The Cabinet Secretary be aware that many of the underlying issues surrounding GP retention in Tayside relate to the poor quality of many of the privately owned surgeries and buildings. In the case of Bridge of Erne, the owner has effectively acted as a rogue landlord for a number of years, and that has led to the GP crisis that we see locally in Bridge of Erne. So can I ask Cabinet Secretary what progress is being made to bring the primary care estate back into public ownership so it can actually meet the needs of 21st century primary integrated healthcare?
Cabinet Secretary.
So the government, as part of the discussion in the first phase of the GP contract, has made additional investment available to primary care, to GP practices, in order to both improve the existing practice but also to remove some of the risk around either ownership or lease of existing practices. We are seeing the development of a mixed model where we have salaried GPs, and indeed in Tayside they have moved quite significantly in that, but also where we continue to have private practice. What I am interested in is primary care as a foundation, as it is indeed the foundation of effective health and social care delivery in our communities, of primary care being that multidisciplinary team providing the care that people need at the point where they need it with the right specialist expertise. And that is the work of our primary care improvement plans, in which we have invested, just for the sake of the record, in terms of Perth and Kinross, 1.5 million to improve it.
David Stewart.
Thank you, Presiding Officer. Audit Scotland's recent report into the planning of primary care clinical workforce recommended improvements to data collection, the monitoring of the GP contract and simplification of workforce planning. Does the Cabinet Secretary accept Audit Scotland's recommendation and share my view that good workforce planning needs accurate and solid data?
Cabinet Secretary.
Yes, I do accept. I think we're on record as accepting the recommendations from Audit Scotland, and of course fundamental to that is quality workforce planning. I know the member knows that it is never an exact science, but a good place to start is with quality data, and we're working to try and ensure, and it is part of the GP contract, if you like the other side of the GP contract, that the data that we receive from our GP practices is consistent across the country, so that we have greater clarity about what is currently in place and what more needs to be done.
Number 5, Patrick Harvey.
Thank you. To ask the Scottish Government what action it is taking to improve healthcare for trans and non-binary people.
Minister Joe Fitzpatrick.
The Scottish Government expects everyone, including trans and non-binary people, to be treated fairly and equally and with respect when seeking healthcare. This was set out in the Charter of Patients' Rights and Responsibilities, published under the Patients' Rights Scotland Act 2011. An updated charter was published in June this year. The Charter states that everyone will be treated fairly and equally and will not be discriminated against. Access to healthcare services will never be affected or refused because of unlawful discrimination based on age, disability, sex or sexuality, gender reassignment, marriage or civil partnership, pregnancy or maternity, race, including colour, nationality, ethnic or national background, or religion or belief. The Charter also sets out the rights for people to be treated with consideration, dignity and respect when accessing and using NHS services.
Patrick Harvey.
The Minister will be aware of a report in the BBC last week about the extremely long waits for treatment that trans people in particular face to even consider beginning hormone therapy. The Minister may also be aware that the First Minister, speaking at an event here in Parliament last week, made it clear that she recognises that the situation is not what it should be in Scotland and that significant improvement is needed. I hope that the Minister will agree with that and will be able to tell us also if he agrees with the views of the Scottish Trans Alliance that some people waiting 2 years for a first appointment is unacceptable and that this could be achieved, huge progress could be achieved with a relatively small increase in the resources that are spent in this area.
Minister.
So I, of course, agree with both the comments of the First Minister and the comments of the Alliance that these waits are unacceptable. The service is currently managed by National Services Scotland, NSD. They commission national managed clinical networks, which aims to foster improved standards and quality in healthcare. These NMCNs include the National Gender Identity Clinic network for Scotland. So that's a network of clinicians and others with an interest in the treatment and support offered to trans people and those distressed or concerned about their experience of their gender, including clarifying issues around access to surgery for trans people. That clinical network works with the Scottish Gender Reassignment Protocol, and they've requested that this be reviewed in the light of the Scottish Public Health Network publication on the topic and changes to international standards due to 2020, and that is a request that we are taking forward. So I absolutely agree with the points we made and hope that we can see progress.
Thank you very much, and I'm afraid we're out of time, so that concludes portfolio questions. I'll just highlight that we did get through all the education questions, but we're apologies to Rona Mackay and Jackie Bailey and the Minister, who didn't get a chance to respond. And I would encourage all members and ministers to be succinct in their questions and answers. We'll move on now to the next item of business.